Hi, this is Ryan. He's going to be my patient for this project today. You can say hello to my proctor, Dr. Scales.
Hi, Dr. Scales.
Okay, so today we are just going to be measuring your range of motion at many different joints throughout your body. So I'm going to be using this fancy little goniometer to measure, and I'm just going to be having to, at times, just kind of point out different landmarks kind of throughout your body, if that sounds okay to you. I'll explain everything that we're going to be doing before we get into it, but in general, does that sound good?
Sounds great.
Okay, perfect. So first, I'm going to have you lie down on your back. Oh, also, here's my little sheet. Sorry. Okay, so you can lie on your back for me, and then I'm going to have you bring your knees up kind of so your feet are flat. Perfect. And then I'm going to go ahead and first I'll explain the first thing we're going to be doing. So you're going to be kind of just bringing your arm back, your shoulder up, kind of arm past your ears as much as you possibly can. Perfect. Alrighty, and then I'm just going to have you come and slide a little bit towards me as much as you can on the edge of the plinth. I'll head check you and make sure you're not going anywhere. Perfect. Alrighty, and then I'm just going to kind of push you through that range of motion so I can feel kind of how it's feeling at the end, if that's okay.
Okay.
Alrighty. Got a little crack. Alrighty. It's good, a very firm end feel, which is good. So now I'm gonna go ahead and just palpate a few different landmarks on your body, if that's okay. Just kind of give them a feel. So I'm gonna start. This one is your greater tubercle. So if you don't mind just doing a little bit of like a windshield wiper with your arm for me. Okay, great, you can relax. So that's gonna be our axis point. And then our stationary arm is going to be parallel to your mid-axillary line here. And then our moving arm is going to be the lateral epicondyle, which, if you don't mind, just gonna fill that out. Perfect. Alrighty. And then you can go ahead and bring that arm back towards your ear whenever you're ready. Good job. And I'm gonna visually estimate that that's about 182-ish. You can relax. And like 187.
Oh boy.
Very good. Alrighty, you can kind of slide over towards the middle. And you can relax your feet down for me. Next, we are going to be doing what's called abduction. So instead of kind of bringing your arm up this way, you're going to be bringing it out towards the side. So if you want to give that a try for me. Very good. I'm just gonna, again, kind of passively move you through that, if that sounds good. Alright, very good. Another firm end feel. So for this one, our landmarks are going to be your acromion process, which do you mind if I kind of just place my hands at your clavicle here? So we're gonna just kind of follow that out here. Very good. And then we are gonna have our stationary arm parallel to your sternum. And your medial epicondyle is going to be the moving arm. So if you don't mind, if I could just, perfect. Thank you very much. We go ahead and get lined up. And alrighty, just gonna kind of stabilize you here, and then you can go ahead and bring that arm out for me. As far as look, I'm gonna visually estimate maybe a little shy of 180. I'm gonna say like 175-ish. And 170 on the dot. Alrighty. Are you feeling any pain with that at all?
No pain.
Okay, so next we are going to do some internal and external rotation at your shoulder. So you're gonna kind of be bringing it down like this and back. First, I'm just gonna put this little pad underneath. If you want to slide over just a touch so I can kind of fit this comfortably underneath, and then you can relax down. We might have you slide just a little bit more over that way. Yes, perfect, thank you. And then you can kind of bring this out to 90 degrees. Very good. Alrighty, you can relax for now. For this one, I'm gonna have my axis point here at your olecranon process. My stationary arm is going to be perpendicular to the floor here, and then I'm going to be having my moving arm at your ulnar styloid process, which is right here. Alrighty, and then first I'm just gonna kind of take you through that motion passively, if that's okay. Alrighty, so we're gonna be internally rotating. Just gonna bring you down here. Right, feel a firm end feel there, and then we'll just go ahead and do external. So firm end feel, very good. You can stay there for me. Alrighty, get those points lined up. And then if you want to just go ahead and bring your fist kind of down towards your head for me. Very good. Alrighty, and before I check, I'm just going to kind of visually estimate. I think it's going to be about 90, maybe a little shy, maybe 85. Alrighty, you can relax. 83. Alrighty, and then we're just going to go through the opposite direction whenever you're ready. Alrighty. And I'm just going to visually estimate a little less. I'm going to say maybe 70, 72-ish. You can relax. A little short, 67. Alrighty, you can relax for me. Are you feeling any pain with that at all?
No pain.
Perfect. Okay, now we are going to go ahead and do some elbow flexion. So you're going to be kind of flexing your muscles there.
Okay.
We're going to actually use this still, but I'm going to go ahead and just fix it a little bit. Ready, and bring that out to. We're going to be actually going this way a little bit. Does that feel comfortable? Okay, you can relax for now. I'm going to go ahead and kind of take you through the range of motion myself for that end feel, if that's okay. Okay. Feels pretty firm, which is good. And then we'll do extension too. I might have you slide over a little bit towards me so I can kind of get that. Perfect. Feel hard end feel there, which is good. So I'm going to go ahead and grab my landmarks, which is going to be that lateral epicondyle that we have learned so much about. My moving arm is going to be your radial styloid process, and then my stationary arm is going to be kind of pointing in the direction of that acromion process right here that we had found before. Alrighty, and then I'm just going to go ahead and get set up. And then you can go ahead and bring that arm towards you. Alrighty. Sorry, I'll have you restart one more time. Sorry about that. Okay. It said acromion here, and then styloid. And we're doing active range of motion. Alrighty, you can go ahead. Alrighty, and you can relax visually. I'm going to, before I you can relax still. I think that was looking at like about maybe 125, 150. So a little more. Okay. Now we can go ahead and do elbow extension as well. So it's going to be those same landmarks as before. Acromion process. And you're going to go ahead and do the opposite for me. So you're just going to bring your arm down whenever you're ready. Good job. Alrighty, and I'm going to guess you have about maybe 12 degrees of hyperextension. 9 degrees of hyperextension.
Oh boy.
Very good. Okay. Now we are going to move on down into the hip, so I can take this out of the way for you. Just gonna bring it down a little bit if you're okay with that. Alrighty. Perfect. So we're gonna do some abduction first, which is gonna mean you're just kind of bringing your leg out. So I'll have you just kind of come towards me a little bit. That's perfect. And then the landmarks that I'm going to be using for this are going to be your ASIS is going to be, which is okay if I for that. Perfect. It's just going to be like the most front bony prominence kind of there at your hip. Perfect. Alrighty. I'm going to be going kind of midline here to your patella. And then I'm going to be, my stationary arm is going to be across to the opposite ASIS. Alrighty. And then, perfect. Perfect. And then you can go ahead and bring that leg out for me as much as you can. Perfect. Alrighty, and I'll kind of hold it there if that's okay with you. I'm just gonna visually estimate. I'm gonna say you've got about 50 degrees there.
Straight.
Alrighty. And 52.
Look at that.
Look at that. Okay, so now we're going to do the opposite and kind of bring your leg inwards. So I'm gonna have you just bring this, your right leg here out to the side a little bit. And then we're gonna have you bring your other leg in kind of past the midline, and we're gonna be on those same landmarks as before. Alrighty, so your patella here, and your ASIS. Alrighty, and then whenever you're ready. Good job. Okay, you can relax. I'm gonna guess that was a little bit less. I'm gonna go with maybe 35 degrees and 25 degrees. So a little bit less. Okay. Now we are going to do some hip flexion. So we're gonna be measuring this hip, and then I'm going to go ahead and have you keep this leg just kind of laying straight. And then whenever you're ready, I'm gonna kind of help you through our range of motion first, but you're gonna be kind of bringing your leg up towards your stomach, and then I'm just gonna help you move through that passively if that's okay. Alrighty. Firm end feel there. Does that feel okay?
I should have worn less tight pants.
Are you comfortable?
Yeah.
Okay. I should have warned you. Alrighty, so for these landmarks, I'm gonna go ahead and palpate your, what's called your greater tubercle. So it's just gonna, or your greater trochanter, sorry, of your femur. So I'm just gonna go ahead and, if it's okay, just touch that ASIS that we had talked about. And then I'm just gonna move down to the side a little bit. And then I'm gonna have you do, remember how we did the windshield wiper with your arm? I'm just gonna have you go ahead and kind of do that with your, you can leave it straight and then kind of just turn your ankles like.
Oh, I see.
Yes, perfect. Oh, right on the money, perfect. Alrighty, you can relax. Alrighty, so there is your greater trochanter. My stationary arm is just gonna kind of be in line with the midline of your pelvis here. And then my moving arm is gonna go down here to the lateral epicondyle of your femur. And then whenever you're ready, I'll just have you keep this relaxed, and I can kind of help you stabilize there, but you're just gonna bring this leg up here. And bend.
So keep my leg straight or bend it?
Bend your leg and then bend at the knee and then kind of bring it up towards you. Perfect. Perfect. Alrighty. And I'm gonna visually estimate, since this is active, I'm gonna visually estimate, sorry, you can relax. I'm gonna say maybe 65, 70. Got about 78, which is very good.
Sweet.
Okay, now I'm going to do knee flexion with you, which is going to be pretty similar to what we just did at the hip joint, but it's going to be at your knee joint, so we're going to be kind of bending that way. Again, you can keep this leg just straight, and then I'm going to just kind of bring this up passively and check out that range of motion before we do it actively. That's okay. Alrighty, just gonna stabilize here. Alrighty, feel that firm end feel. You can relax. Alrighty, so for these landmarks, I am going to be at that same lateral epicondyle on your femur, and then I'm going to be coming up towards that greater trochanter. And then I'm going to be aligned with kind of just your like lateral malleolus here, which is just going to be that like lateral bump on the outside of your ankle. Alrighty. So I'm going to go ahead and have you flex as much as you can at the knee, and then I'm just going to go ahead and see if I can kind of, we'll do this one passively, so I'll see how much I can kind of push you into. So if you want to just flex that knee up.
Okay.
Perfect. And then we're going to go passive on this one, so I'm just going to my landmarks here. And then a little push. Alrighty. And it looks like we're at about 145, which is very good. Okay, now we are going to do knee extension, which is kind of the opposite of what we just did.
Okay.
But I'm just gonna put a little kind of elevation here underneath your ankle so that we can kind of get a better look. And then I'm gonna, again, just do this passively.
Okay.
First, I'm just gonna kind of feel for the thin feel here, which feels pretty hard, I would say. So now we're gonna kind of do the same thing with those same landmarks, but just see if I can kind of force your knee down into a little bit of extension there.
Okay.
So we'll be at that lateral epicondyle, greater trochanter, and the lateral malleolus. And we're gonna go passively for this one, so I'm just gonna kind of push down here. And it looks like you might have about maybe 9 degrees hyperextension. And looks like about 6 or 7.
Okay.
Alrighty. And now we are going to do your flexion of your toe. So if you wouldn't mind just taking that left sock off of me. Might have to move down here a little bit. Okay. Perfect. I'll take this out of your way. Then you go ahead and grab my smaller goniometer. And then hopefully you can see this. I think it's okay. So we're going to be measuring your kind of flexion that you have going on at your great toe, and we're going to do this, which is this big toe, and we're going to do this one passively as well.
Okay.
So first I'm just going to kind of go myself and feel that and feel with your flexion. So we're going to go here. Okay, pretty firm and feel, and then we'll go extension. Also firm, we've got some good extension there. Alrighty. And now I'm just gonna find those landmarks. So it's going to be your metatarsophalangeal joint here. My stationary is going to be the proximal metatarsal, and then your proximal phalanx of the great toe. I'm gonna go ahead and find those landmarks. And then I'm gonna help stabilize here, and then just kind of push you into flexion whenever you're ready. Okay. Ready, and it looks, let me take that away. Looks to be like maybe 35, 40 degrees.
Cool.
Let me give it a try. Okay. 39. Okay.
Nice.
You're perfect. Now we're gonna do extension. Okay. And looks to be less, maybe about 20 degrees. Or a lot more than 20, perhaps. Perhaps more like 65. Perhaps.
Yeah.
Okay. And that is everything in this position. So are you ready to do it all on the other side?
Let's go.
Perfect.
Should I flip this way?
Sure.
Would that be helpful?
That would be very helpful.
Okay.
Thank you so much. You're welcome to put your sock back on
Okay. Until the next toe exercises.
until the next toe exercise.
Okay.
Alrighty. Now we're back to square one.
Woohoo!
So now you bring those knees up again. We're gonna go back to our flexion at the shoulders. Perfect. You know the drill already. I'll switch out for my big goniometer. And then we're just going to be using all the same landmarks as previously mentioned. So I'll have you kind of windshield wipe again for me, if you don't mind.
Oh, yep, I forgot.
Oh, sorry, I wasn't even. Okay, perfect. Thank you. And then I'm just gonna go ahead and passively move you through that range of motion again, if that's okay. Ready? And then feel. Might have even a little bit more. I kind of forget what I said before, but okay, you can relax. Ready? I'm gonna go ahead and grab those landmarks. Alrighty, and you can go ahead and raise the arm whenever you're ready. So I'm gonna visually estimate like maybe like 181, maybe, perhaps. So 176. Okay, a little bit less actually than the other side. You can kind of switch towards the middle. Now we are going to do our abduction. Again, using all the same landmarks as before, so that's going to be the one where you're kind of raising out towards the side. I'll do it passively just so you can get that end feel again. And you can kind of lean your head towards the side. It looks like we probably won't get over, but alrighty. Another firm end feel. I'm going to go ahead and grab my landmarks. And you can go ahead and actively bring that out to the side. Okay, I'm going to guess this is like a little shy of 180, maybe 178. 175.
Nice.
Alrighty. Now we are gonna go ahead and do our internal and external rotation. So I'm gonna go ahead and grab a towel. You know the drill already. You're a genius. Okay, and then you can kind of go ahead and bring that out to the side at like a 90-degree angle here. Perfect. Alrighty. Is that comfortable?
Super.
Awesome. We'll go ahead and you remember what we're doing. So first you can kind of bring it down before, which you can. Sorry, I'm just gonna get organized. My fault. You can go ahead and bring it down. Maybe I'm gonna say a little shy of 90, maybe 87. Relax. 85. Alrighty. And then you can go ahead and bring it back towards your head. Maybe 90 even. You can relax. 87.
Nice.
Alrighty. And now we'll go ahead and do our elbow flexion. So I'm gonna just move this over a little bit. We're gonna be bringing the elbow up. So it's like we're flexing again. I'll move us passively through this first. Let me go ahead and very firm end feel there. And go ahead and grab our landmarks. Styloid. And you can go ahead and actively move through that. I'm going to visually say maybe 125, 130, 140, 140.
Sweet.
Okay, next up we're going to do extension, so it's going to be the same kind of landmarks here. Alrighty. And then I'm just going to move this a little bit so you can get a better, there you go. Alrighty, and you can kind of go ahead and bring that arm down as much as you can. I'm going to guess maybe 10 degrees hyperextension. Relax. 15 degrees hyperextension.
Oh boy.
Look at that.
I am flexible.
Super flexible. Now we're gonna go ahead and move into our hip abduction. So I'll take this out of the way for you. And you can kind of slide a little bit towards me if you can, but you don't have to be right on the edge.
I'm just kidding.
Okay. And then again, using the same landmarks that we had previously talked about. So we're just gonna go. And then first, of course, I'll measure possibly myself. That's okay. Alrighty, so we're gonna be bringing that hip out. Another firm and feel, which is very good. And now we'll go ahead and measure. Alrighty, and you can go ahead and dip it out for me. I'm gonna kind of hold you there if that's okay. I'm not gonna help you, but just so it's not, you can relax. Or sorry, relax into my hand. I can almost hold you up there. Perfect. Okay, I'm gonna guesstimate about 47 degrees maybe? Like 51.
Nice.
Alrighty, so now we're gonna do, you know the drill already? You're perfect. Okay, so now we're gonna be bringing it in. I'll just kind of feel that and feel again. That's okay. Feels firm. Awesome. Get our landmarks going. And you can go ahead and bring it in for me as much as you can. Very good. I'm gonna say 24 degrees maybe? Relax. 24 degrees.
On the money.
Okay. Alrighty, now we're going to do that hip flexion that we talked about. So bringing the hip in. And it's active. I'm going to go ahead and passively move you through that if that's okay. Okay. Firm and feel. Relax. Again, our same landmarks that we had discussed. Of course. Oh, wow, look at that. It's almost like we practiced or something.
What?
Okay, there you go. Thank you very much. Relax. We're going to be... Okay. Alrighty, you can go ahead and bring up that hip for me. Sorry, can you relax? I have no landmarks finger. Okay, now you can go ahead.
Now go?
Yes. And you can relax. I'm going to guess that was... Can you do it one more time? Sorry.
All good.
Sorry, is that uncomfortable to hold it? But
No, that's okay.
I can do it passively if that's easier.
No, it's okay.
Okay. Alrighty. You can go ahead. Okay. I'm gonna say, like, maybe, sorry, you can relax 100.
I'm thinking like 92.
110.
Oh, that's so... You were way closer.
I think, yeah, wow. That's a lot of...
Flexion.
Yeah, I believe the norms are 0 to 135, but don't quote me on that. Okay. Now we're going to do knee flexion and extension. So I'm going to go ahead and we'll do extension first. So I'll have you just kind of relax that leg down. Ready? And I'm just going to kind of push you into extension to get that end feel. It feels very hard. Does that feel okay?
Just good.
Alright. So now I'm going to go ahead and grab those landmarks. And I'm going to passively see if I can push you into a little bit more in extension, if that's okay. Looks like maybe 5 degrees, but that's Okay. Looks like about 3.
Nice.
Okay. Now flexion, of course.
Mm-hmm.
We're gonna do the same kind of landmarks. And then I'll kind of passively push you through, if that's okay.
Mm-hmm.
It's firm. Does that feel okay?
Feels good.
Good. Very good. Alrighty, and then I'll kind of do this one passively as well, if that's okay. Unless we did active for us, so we should probably stick to that.
Mm-hmm.
So you can go ahead and kind of start flexing that knee for me up. Perfect. Alrighty. And is that everything? Can you get a little more? I'm gonna kind of stabilize you here so you're not cheating. Okay. Very good. I'm gonna say 135.
I agree.
136.
Oh man.
It might be 7. I might have cheated you a tiny bit. Okay. Very good. Now we're back to the great toe. If you don't mind popping that top off for me.
Oh boy.
Exciting stuff. Alrighty. I'm gonna go ahead and come around here. You can extend it out for me. Perfect. Thanks so much. We're again gonna be doing. Oh.
Yep.
Thanks. Oh, perfect.
Sorry.
For me. No, this is perfect. Okay. So we can do our. Maybe we'll do our flexion first. I'll just kind of push you into, if that's okay.
Mm-hmm.
Ready? Another firm end feel. Okay. Flexion. A lot of flexion going on there.
Oh, sweet.
Very good. Okay. I'm gonna grab my landmarks again. And stabilize here. And ready? I'm gonna say I kind of feel like you have a lot of flexion here. Perhaps like 130, 140, but let's see. Perhaps. Perhaps not that much. Perhaps like 90. Maybe. Sorry, I'm just taking a moment
No worries.
to think about it.
Mm-hmm.
Because neither of those sound right.
Mm-hmm. Because what are your landmarks again? I forget.
My metatarsophalangeal joint, my first metatarsal,
Mm-hmm.
and then my proximal phalange.
Yeah, proximal.
So not quite so much. Perhaps more like 30.
Mm.
Yeah, that makes more sense. Okay. And then we'll do extension. Okay. Perhaps more like. Sorry.
Oh, good. You could probably push it more if you wanted to.
Yeah. Okay. That's looking more like maybe like 65.
Mm-hmm.
Or 55. Or 55.
On the money.
Okay. That is everything on both sides for that. So now I'm gonna go ahead and have you, whenever you're ready, lay on your stomach.
Mm-hmm. Get some tummy time?
Of course.
Mm-hmm.
It's really good for you. Okay, so now we are going to do extension, which is going to be kind of the opposite when we're doing flexion here. So we're going to go backwards.
Oh, backwards.
Of
Okay.
course. So for this one, you'll be laying, and then I'm going to have you turn your head towards the opposite way for me.
Okay.
And then I'm going to go ahead and kind of just passively move you through this, if that's okay.
Mm-hmm.
Go ahead and bring you back. I'm not going to let you cheat by rotating. Okay. Firm end feel. Good. Now I'm going to go ahead which is going to be the same as we did for our flexion. So I'm going to go ahead and grab that greater tubercle, and then if you could just, you know the drill by now. Sorry.
Okay.
Okay. And then your mid axillary line is going to be my stationary arm, and then I'm going to go ahead and grab your lateral epicondyle here. Okay. Alrighty, and then you can go ahead and bring that arm back for me. Alrighty. And I'm going to say like 50 degrees. You can relax. 45.
Sweet.
Alrighty. Now we are going to go with some hip extension, which is going to be the opposite of kind of when we went this way. So we're going to,
Like doing little donkey kicks.
Yep, of course. So I'm going to go ahead and grab my landmarks on here, which is going to be that greater trochanter of the femur. Very good. Feel it moving. You can relax. Thank you. And then, okay, I'm gonna do it passively first, and then we'll.
Okay.
But there she is. Alrighty, I'm just gonna go ahead and. Does that feel okay? Okay. Firm and feel. Alrighty. So I'll grab that greater trochanter. And then I kind of line up with this midline here of your pelvis. And then I'm going to be lined up with that lateral epicondyle on your femur. And then whenever you're ready, you'll kind of have you actively bring that leg up for me. And then you can leave that other leg flat, just on the perfect. Alrighty. I'm gonna say, like, here, you can relax. Maybe. I might have to go on.
Yep.
Down, but I'm gonna say that was like maybe 25, 30 degrees.
Okay.
Oh, this looks like maybe perhaps more than that. Maybe you're not compensating. You can relax. Not compensating on your hips, which is good, but you just got a little more. It looked like maybe 40.
Oh. Second time's a charm.
More like 35.
Okay, right in the middle.
But that's okay. Okay. And that was everything for that. So now we're just gonna go ahead and do the same exact thing on the other side, if that's okay.
Okay. Do a little flippy flip.
Little flip.
You gotta get everything on camera.
Okay. I'll go ahead and get that end feel, if you don't mind.
So you want to do this one first?
Oh.
Yep.
Sure. Sorry. Okay.
Okay.
You're ready for the next one. Another firm end feel. And I'll go ahead and have you kind of do that windshield wipe again. Okay, perfect. You can relax. We're just going to be doing those same landmarks as previously. You can go ahead and lift up for me. This looks like perhaps a little bit more. Perhaps 30. Perhaps, you can relax. Perhaps 36, except for I knocked it down again, so you might have to go just one more time. Sorry, but I think it was looking like 36.
Okay.
Okay, go ahead. Okay, now you can relax. Okay. And more like 29.
Okay.
But that's okay.
Mm-hmm.
Maybe you had it better on the first one.
Mm-hmm.
Okay. And shoulder extension.
Mm-hmm.
It'll come over here again, and then you're just going to be bringing that arm back behind. Once I get myself situated, you could windshield wipe for me. Okay, perfect. Gonna be our midline. Lateral condyle. Okay, perfect. You can go ahead and bring that arm back for me. Actually, sorry. Sorry about that.
No worries.
I have my arms mixed up. Okay, now you can go ahead. is more like maybe 45, you know? 42. Woohoo! Alrighty, and that was everything for that. So now you can sit up for me. And we are going to measure some internal and external rotation of your hip.
Yay.
So it looks like if you can scoot up just a tiny bit forward. Perfect. You just need your legs here at a 90-degree angle. And then I'll do maybe your right side first perhaps, and then we'll go to the left.
Okay.
So I'm gonna be going ahead and just kind of moving your leg. Is it okay if I show you what we're gonna do? So we're just gonna kind of be taking it out the side like that, and then in like this. Which is a pretty firm end feel both times there, which is good. So I'm gonna go ahead and grab my landmarks, which is going to be the base here of your patella. And then I'm kind of going to come down towards just kind of this midline in between your two malleoli here. And then I'm going to be bringing my moving arm. My stationary arm will be parallel to the floor here, and then my moving arm is going to be kind of traveling out right here at this kind of midline of your ankle. And then you're going to be bringing your leg out towards the side.
Actively?
Yes.
Okay.
Whenever you're ready.
Okay. 1, 2, 3.
There we go. Alrighty, you can relax. Alrighty. Perhaps 37.
Not super great on that one.
That's okay.
My hip was cramping again.
Are you okay?
Yeah, no, I'm good.
Are you sure? Okay. And perhaps 43, 44.
Okay.
Okay, now we'll go internally. And so then you can just kind of bring your leg in there. Perfect. This looks like a little bit less. You can relax. Maybe 32. Or maybe 28.
Oh.
Okay.
No bueno.
That's okay. Alrighty. Now we just did internal and external. Maybe we'll do everything on this one side and then we'll move on to the other side.
Okay.
So now we're gonna do some ankle, dorsal, and plantar flexion, and I'll show you what that's gonna be. So you're gonna be in the same position. I'll have you take your sock off whenever you're ready. But you're gonna be kind of bringing the ankle up towards the sky and then down towards the floor.
Okay.
You're perfect.
Well, thanks.
That's my word, if you couldn't tell.
Wait,
Okay.
I thought I was just perfect.
I think you are. Okay, so we'll start with our dorsiflexion first, if that's okay. So we're going to be kind of here in neutral, and then I'm going to kind of bring your foot up. So pretty firm end feel, I would say. And then we're going to go down. Also nice and firm end feel. Kind of just stabilizing here at your tibia and your fibula. And then I'm going to go ahead and grab my landmarks, which are going to be your axis point is kind of this lateral malleolus on the side of your ankle. I'm going to be parallel to your 5th metatarsal. And I am going to be, my stationary arm is going to kind of be at this lateral point of your leg, kind of pointing up towards the lateral epicondyle of the femur here. And then I'm going to go ahead and just get lined up, and then I'll have you just kind of actively bring your foot up, if you could, towards the sky. Let me twist a little bit. Okay, it's looking like maybe 15 degrees. Or maybe 12 degrees.
Okay.
Now we're gonna go ahead and do the same thing, but we're gonna point down towards the ground. Ready? This is looking like maybe it's gonna be much more, maybe like 60 degrees. I'll go 55 degrees.
Mm-hmm.
52 degrees.
Nice.
Alrighty. Now we can go ahead and do some inversion and eversion, which is going to be you're just going to be taking your leg kind of in and out at the ankle.
Mm-hmm.
So you're going to be kind of going down and in, and then up and out.
Okay.
Hi, sorry. You're fine. Okay. So my landmarks for this are going to be this kind of midpoint between your malleoli. And then I'm going to be kind of pointing up towards this tibial tuberosity, which is kind of just the most like prominent bony protuberance there, or bump, if you will. And then I'm going to be going down towards your second metatarsal here for my moving arm.
We're going hamburger.
Okay, that's a good idea. It's okay, everyone makes mistakes.
Yep, my bad.
No, that's okay.
Bad patient.
It's okay. All right, so now I'm gonna go ahead, my landmarks, and I'm gonna kind of stabilize here at your tibia and fibula, and then I'll have you bring your foot kind of down and in towards your other foot. Very good. Alrighty, I'm gonna say maybe like 20 or maybe like 15 degrees. Or like 14 degrees.
Okay.
Okay, and now we'll kind of do the opposite, so we're kind of gonna go up and out. Perfect. I'm gonna say a little more. You can relax, maybe like 20, 25, 21. Alrighty. Now we're going to do some TMJ depression.
Ooh.
Which is your temporomandibular joint, which is kind of your jaw here. I'm gonna go ahead and wash this off since we did just use it on your toe.
Oh, okay, thank you.
Of course, so I will be right over here washing off my thing.
And I'll sing a song in the meantime.
Please do.
Maybe I'll put the sock on in the meantime.
Oh, perfect. Are you feeling safe and comfortable?
I'm feeling very safe and comfortable.
Perfect. Perfect. So for this one, we are going to kind of just be measuring like how much you can depress your jaw and open your mouth. So the first thing I'll ask you is, can you fit 2 fingers like this kind of in between your teeth? Like kind of like this. Very good. Can you do 3? Okay, just about. Doesn't look like you can get 4.
No.
Okay, so what I'm going to be doing is having you open your mouth kind of as wide as you can, and then I'm just going to kind of be measuring the bottom tip of your incisors here to the ones right on your bottom teeth.
Okay.
I'm just going to be measuring that space. So whenever you're ready, you can just open your mouth as wide as you can. I'm going to call it an even 6 centimeters.
Nice.
Very nice. Okay. And that is all that I have for you seated in this position. So we're gonna go ahead and get the other side, if that's okay. And I am maybe gonna start off with your, actually, we don't have to do TMJ on both sides, so never mind. I was gonna say,
Oh,
we'll
yeah.
have to wash this off again. We will start with our hip internal and external rotation again. So I'm gonna go ahead and grab the same landmarks as we have been using before. And then we're gonna be kind of going out toward the side first. If that's okay. First, I'll kind of get that in feel and do it for you. If that's okay.
Yep.
Okay. Firm and feel. No pain with that or anything?
No.
Okay, another firm and feel, which is good. Alrighty, I'll grab my landmarks. And you can go ahead and bring that leg out whenever you're ready. Ready? I'm gonna say like maybe 10 degrees, 15 degrees, maybe. That seems a little short.
I know. Bad hips.
We'll do it one more time, perhaps. Good. We still at 90 degrees here. Maybe scooch back like a tiny bit. Okay, perfect. All right, let's try it one more time. Okay, go ahead. And it doesn't look like you're compensating. I'll call that like 35.
Nice.
More like 40.
I just needed to try harder.
You just didn't care. Just kidding. Okay, so now we're gonna go inwards. So you can go ahead whenever you're ready. And I'm gonna call that about the same, I think.
Cool.
I'll call it 39. Pretty close.
Nice.
Okay. Next is gonna be our ankle dorsal and plantar flexion. So if you wouldn't mind taking that sock off for me one more time. Thank you so much.
I think you just like seeing my feet.
Sure. You have wonderful feet. They're very good. Okay, we'll start with, sorry.
Okay.
So sorry about that. Okay, we're gonna be using the same landmarks again. And then, do you prefer to go up or down first?
Let's go up first.
Crazy, I like it though. Okay, first I'll kind of passively take you through it. Excuse me.
I know they stink.
Funny. Alrighty, go ahead. It's pretty firm. And then I'll go ahead and bring you down, stabilize here. Nice and firm. Very good. Okay, I'll have my stationary arm here. And kind of stabilize here at your tibia and fibula. And then whenever you're ready, you can go ahead and lift that foot up towards the sky. Very good. You can relax. We'll call that like 30 degrees, maybe? Or I'll call it like 18 degrees. Maybe.
Nice.
Okay. I feel like you had more the last time we did it.
I think for the dorsiflexion on the right.
Yeah.
I think it was less actually.
You think? Alright. Now we'll go ahead and kind of bring your toe down towards the ground whenever you're ready. Ready, you can relax. I'll call that like 50. Maybe. Or I'll call it a lot more than that. Or I'll call it like 65.
Oh man. Nice.
I think the norms are 60. Mind if I do that one more time? Okay, you can go ahead. Yeah, I would call that way more. Try to keep it parallel. I would call that, yeah, maybe even 65. Yeah.
Nice.
Or like 65, 70. Okay.
I should be a ballerina.
You should. Okay, now we're gonna do inversion and inversion.
Oh yeah.
Ready, using the same landmarks again. Okay. So we're gonna grab your second metatarsal malleolus. And would you rather go down and in or up and out?
Let's go down and in.
Like it. Okay. Ready, you can go ahead. Okay. Ready. You call that like 15 degrees maybe? like 16, 17 degrees.
Okay.
Okay. Now you can go ahead and go towards the outside for me. Alrighty. We'll call that more like 25 maybe. Or 23. Okay. And that is all for that. You can go ahead and pop your sock back on for me. Thank you. We're very close to being done, kind of, sort of.
Yay!
Okay. Now I'm gonna go ahead and have you sit in that chair for me. Switching up from sitting on there.
Okay.
Getting crazy, I know. Okay. So we will start with our, we can start with some thoracolumbar rotation, which sounds crazy, but it's not so bad. I might have to move this for the camera so I can kind of have you sitting right in front.
Okay. Just front and center.
And then, not to be scared, but I'm just gonna pop up on the table
Okay.
behind you. But so for this one, I'm going to have you kind of, I'll find those prominences and landmarks on you, and then when you're ready, I'm just gonna have you kind of cross your arms and then turn towards one side, and then turn towards the other side.
Okay.
Does that sound okay?
Mm-hmm.
Alrighty. First thing I'm gonna have you do is kind of touch that like out frontmost kind of landmark that's bumping out. Okay, perfect.
Mm-hmm.
That is gonna be your ASIS. And then I'm gonna go ahead and kind of palpate that acromion process again. Okay. Perfect, thank you. And then my stationary arm is just gonna be kind of or my moving arm is gonna be your acromion here. And then my stationary is gonna be kind of just an imaginary line between those two marks that you're holding on to for me right now. Thank you. You can go ahead and let go now. And then my moving is going to be your acromion, and then my axis point is just right on top of the head. And then you can cross those arms for me whenever you're ready. And then you can kind of come towards the right side for me. Great job. Alrighty, you can relax. And we will call that. Do you mind doing it one more time for me?
Mm-hmm.
Thank you. Sorry, you can come back to neutral super quickly. I'm just gonna grab your ASIS and acromion, and now you can go ahead and turn. Alrighty, perfect. We'll call that 30 degrees, and we'll call that actually 25 degrees. And now we're gonna go ahead and go to the other side. Alrighty, and you can go ahead and turn. And I might call that a little bit more, maybe 30. 30? Okay.
Nice.
Very good. Next, sorry, I was looming over you. Next, we're going to go ahead and do our cervical flexion and extension. So what that's going to be doing is kind of have you looking down and up. Does that make sense? Alrighty, so my landmarks are going to be your external auditory meatus. Go ahead and get down here, and then I'm going to be at kind of just perpendicular for my stationary arm, and then my moving arm is going to be the base of your nares or your nose. And then I'm going to go ahead and have you look up towards the sky whenever you're ready. And I might call that 44 degrees, maybe. 45 degrees almost. Yeah, I might call that more like 48 degrees.
Money.
Okay. And then we're gonna go ahead and do the same thing, but kind of look down and tuck your chin.
Okay.
Alrighty, whenever you're ready. Alrighty. Perfect. I might call that pretty even, honestly. It looks a little bit less, actually. Sorry. I might call that much less, actually. Mind if I do it again? I'm thinking like 35, but they should be pretty close. I'm just gonna make sure you're not. Okay. Go ahead.
Which way are we going again? Down?
Going down.
Okay.
Okay. And I would call that 40. It's a little bit closer. I was getting 35 the first time.
Okay.
I knew you had a little more.
Yeah.
Okay. Now we did flexion and extension. Now we're going to do some rotation. So I'm just gonna go ahead and pop back behind you.
Mm-hmm.
Don't be alarmed. I'm just gonna bring this lens down a little bit so I can kind of lean forward.
Mm-hmm.
You're fine there. Okay. So now I'm going to have my axis point at your C7, which I already have my landmarks marked off with an expo marker for reference. So I'm gonna grab your C7 here, and that's gonna be my axis point, and then my stationary is going to be just kind of parallel here to these vertebrae, and then my moving arm is going to be with your external occipital protuberance, also known as the bump of knowledge, which I'm just going to palpate super quickly.
Mm-hmm.
Perfect.
My bump of knowledge is really big?
It's huge.
Oh, boy.
Alrighty, and then you can go ahead and bring your ear towards your shoulder on this left side for me. Okay. And let's call that like 35 degrees maybe, or 31 degrees. And now let's go ahead and grab the other side. Okay, relax. That seems a little bit more. Feels more like 35. Well, that's a little pretty even, actually.
It's close.
Okay. Very good. Both sides, do both sides. Now we are going to do some pronation and supination, which is pretty fun. So it's going to be of your wrist, and supination will start like this. Supination is going to be like you're holding a bowl of soup in your hand, and then
Soup.
pronation is going to be more like you're just dumping the soup out. Perfect. So we can start on this side for now. So I'm gonna have you tuck your elbow in kind of at your side. Perfect. And then you'll be in that neutral position. Very good. Would you like to supinate or pronate?
Let's dump out soup and then we'll put some back in.
Sounds good. Alrighty. So we're gonna be on this side, and we're gonna be at your ulnar styloid process for our axis point. I might have to just get a little bit. Hopefully you can still see that. And then I'm going to just be perpendicular to the floor, and then my moving arm here is just gonna kind of come on the anterior aspect of the wrist from styloid process to styloid process. And then whenever you're ready, I'm gonna have you hold that bowl of soup. So you can just kind of turn that thumb out towards the side.
Okay.
Thank you. And I'll maybe call it 75, if you relax. Or 60.
Cool.
Okay. And now we're gonna do the same thing, but on this side. So I'm gonna be with that ulnar styloid again. And this time we're gonna be on the dorsal aspect of the hand. And then whenever you're ready, you can dump out the bowl of soup. Okay, you can relax. I'd call that a little bit more, maybe. I said 65, I'd call it maybe 70. I would call it maybe 71.
Ooh, boy.
Okay. Alrighty. What is next? Maybe I'll just go ahead and grab that other side just while. Actually, Yeah, I will.
Okay.
We'll go ahead and do the other side too.
Starting to.
Same thing. We're going to be using the same landmarks. Ulnar styloid. And then you're going to be turning your thumb towards the outside whenever I say go.
Mm-hmm.
Alrighty. And of course I'm going to feel that end feel, of course. So I'm just going to go ahead and stabilize you and just kind of nice firm end feel.
Mm-hmm.
Very good. And I'm going to do it on the other side too, of course.
Mm-hmm.
Very good. Feels firm on both sides as well. Okay. Great.
Awesome.
Now I'll go here and you'll turn out towards
Yep, getting that bowl of soup.
Of course, whenever you're ready. Okay. Seems pretty even towards the other side. Maybe we'll go to like 65 or 70.
Oh, nice.
Okay, now we'll do the other side. Perfect. And then you can kind of bring that thumb in. This feels almost maybe less, like 60,
Mm-hmm.
64.
Mm.
Okay. A little bit of,
Yeah.
we'll work on it, don't worry. Okay, perfect, got that on both sides. Now we're just going to do a little bit of wrist flexion and extension. So I'll go ahead and have you be in good view of the camera, so I might have to move it, but I'm gonna have you, I might move it over there and have you kind of come here, so if you can stand up.
Yep.
And then I'll move the chair and the camera, of course.
Mm-hmm.
So I'm gonna have you have your wrist off of the,
Oh, I see. Okay.
and might just unplug this.
Do you want?
Yeah, if you don't mind. Thank you. Okay,
Is that good?
perfect view.
Perfect.
Okay, so we'll start here. And I'm gonna go ahead and do some wrist flexion and extension. So we'll be kind of hanging off here. I'll have you keep your palm facing down, and then I'm just gonna kind of passively move you through. So I'll be bending your wrist down like this, and then up like this, if that's okay.
Okay.
Okay. This feels a little soft.
You want more?
I could probably get a little more flexion. There we go. Firm end feel. Firm end feel. Wonderful. Alrighty, and then I'm gonna go ahead and find my landmarks, which is going to be your triquetrum, which is a bone right here in your hand. It's kind of near this kind of styloid process that we've been so
fond of.
Okay, so that's gonna be my axis point. You can relax your hand while I'm just kind of talking you through it.
Mm-hmm.
And then I'm going to be in line with your olecranon, which is this kind of bump right back here on your elbow.
Mm-hmm.
And then my moving arm is going to be your metacarpal right here.
Mm-hmm.
Alrighty, and then I'm just gonna kind of stabilize at your wrist here. So we're not compensating, and then whenever you're ready, I'll have you kind of bring it down actively. Very good. I'm gonna call this not quite 90. I'm gonna say maybe like an 80, perhaps.
Mm-hmm.
Perhaps an 81.
Oh, on the money.
And then, are you okay?
Yep.
When you shake it out?
Yep, just cramping, that's all.
Do you wanna take a break?
No, it's okay. I just need to drink more electrolytes in general.
Would you like a drink of water?
No, it's okay.
Do you promise?
Pinky.
Okay. Are you in any pain at all?
No pain.
Okay.
Mm-hmm.
We're gonna go ahead and use the same landmarks, and we're gonna kind of go into extension. So you're gonna bring that wrist back up for
Okay.
me, if you could. Grab your triquetrum, and go ahead. Careful. You can relax. I'm gonna call that maybe 70, 75, maybe. I'm gonna call that 76.
Nice.
Okay. Perfect. Let's see what's next on the agenda.
Mm-hmm.
Excuse me. We did all of that. We did flexion extension. We are going to do some wrist and ulnar deviation, which is super fun. And then, okay, perfect. So I'm gonna have you maybe just scoot back in this chair if you could just stand up. So I'm gonna have you rest your wrist kind of there.
Okay.
So a wrist and ulnar, radial and ulnar deviation is gonna be, you're gonna be kind of stabilized here, and then we're gonna kind of bring it out towards the side and then in towards the middle.
Okay.
That sounds good.
Sounds like a great plan.
Wonderful. I'm gonna go ahead and kind of get that end feel, if that's okay. I can stabilize
Okay.
it for you. Okay. We're gonna go ahead and very firm. So very firm. Okay. Very good. So my landmarks for this are going to be, my moving arm is going to be right here on the metacarpal of your third metacarpal. And then I'm going to be in line with your capitate, which if I follow this all the way down, there's going to be a little space for this bone. In line. Perfect. Thank you. And then I'm going to be kind of going back towards this lateral epicondyle for my stationary arm. So I'm going to go ahead and find all those landmarks. And then I'm going to use this here to kind of stabilize at your wrist.
Okay.
Would you like to go in or out first?
Let's go in.
Let's go in.
Okay.
Alright, so whenever you're ready, you can kind of bring that thumb towards yourself. Okay, perfect. Let's call that 35. You can relax. Let's call it 36.
Oh man.
Okay, now let's go ahead and go back towards the outside. Let's call that a little bit more. Let's call that 42.
I'm thinking 41.
Let's call it 39. Okay. Now we're going to do our finger flexion, which is going to be fun.
Yeah.
So you can kind of go and relax your hand there. Just need to shake it out. Feeling good? Okay, good. So we're going to start with our MCP flexion, which this is your kind of punchers, your knuckles, your MCPs. So I'll have you kind of just put your hand in neutral there for me. Thank you. I'm gonna bring this up just a little bit, if that's all right with you.
That sounds great.
Wonderful. Okay, perfect.
Should we sit across the table?
Should we arm wrestle?
Yeah, that's what I was kind of thinking.
Okay, so here is your MCP joint, which is going to be my axis. Your metacarpal is going to be my stationary, and then this proximal phalange is going to be my moving. So I'm just going to get set up for that and stabilize. And then I am going to passively move you through this one, if that's okay. I'll start just by getting that end feel, which is going to be pretty firm, I would say. So now I'll kind of stabilize you here. And then whenever you're ready, I'm just going to kind of push your fingers through. Sorry.
Dude, my thumb's getting in the way.
Here, if you want to just, you can like tuck it. Perfect. Sorry. Okay, and then I'll go ahead. This looks pretty good, pretty solid. I might call that 100. Perhaps.
Flexible.
Very flexible. I might call that more than 100, which, might I try it one more time? I think my issue is your thumb.
My thumb
kind
is
of getting a little,
yeah.
So I'm just gonna go ahead and kind of lay on top of that. Sorry if that's hurting your thumb.
No, it's okay.
I'm gonna go ahead and purple. 484, I would call that.
Okay.
Okay. Now we're gonna go ahead and do the same thing, but extension.
Okay.
And just gonna grab that. Okay, and then I'm gonna just push you into extension. First, I'll just feel that and feel which is a firm end feel. And now I'll go ahead and measure it, which you definitely have a couple degrees of hyperextension. Maybe we'll call it 7. Or we'll call it 12. Okay, very cool. Now we're going to do our proximal interphalangeal flexion extension. So that's going to be, this is going to be our hip joint right here. So that's our flexion there.
Okay.
So I'm going to go ahead and grab that proximal interphalangeal joint, which is going to be our axis. Our proximal phalange is going to be our stationary arm, and then our middle phalange is going to be our moving arm. So I'll go ahead and just kind of grab those. Thanks for keeping that thumb out of the way for me. First, I'll kind of just passively move you through it, which looks really flexible. Very good. Now we're gonna kind of get aligned, and then I'll just kind of move you through it. Very flexible. Very good. Okay. Might we call this like 112 maybe? Might we call this a lot more than that? I think I'm gonna try to stabilize a little bit better. I don't think I was quite on the money with that. You can do it actively, which looks pretty good. It's looking to be 142.
Oh boy.
Which sounds a little insane. Let's try it one more time. Our proximal phalange and our middle phalange. That's about 120. That seems like a lot. I think you've got some hypermobility there. Is that something that's typical?
Well, I mean, I feel like I've had a few joints that have been hypermobile, and then other ones that I have not had that were hypermobile.
Got you. Alrighty. Maybe we'll go ahead and do the other hand. Just while we're at it. Which maybe actually we'll finish our thumb opposition, and then we'll do everything on this side.
Okay.
So what that's gonna mean is you're gonna kind of lay flat here with your palm facing up. I'm gonna kind of hold on to you here, and then you're gonna be bringing your thumb in towards this crease on your pinky finger. And then I'm just gonna kind of be measuring the space between. But I'm gonna hold on here so that you're not able to kind of cheat and turn your hand in.
Okay.
So you're just gonna be bringing your thumb as far towards this crease of your pinky as you can.
Okay.
Alrighty, whenever you're ready. Very good. You hit it right on the money. So there's no need to measure anything. It would be 0 centimeters there.
Okay.
So very good thumb opposition for you.
Yay.
Now we're going to move on to the other side. We're very close, I promise. We did forearm pronation and supination on both sides. I don't believe we did our wrist flexion and extension on both sides. So I think that's what we're going to start with. So I might even have, not something comfortable for you. I'll have you maybe kind of
We'll flip sides.
If that's okay. You can.
Oh.
Perfect.
Sorry.
I was trying to think if I need.
Do you want this
or
one?
anything, but no.
Okay.
If you needed like the, stabilization, but you do not for this one. Alrighty. Again, I'm going to be using the same landmarks as we previously mentioned. And then we're just gonna go ahead and get measuring. Would you rather go up or down first?
Let's go up.
Crazy man, I like it. Okay, just gonna go ahead and get my line marks. And you can go ahead and first I'll passively measure.
Okay.
So we're gonna go ahead. So for men too, a lot of flexion there.
Mm-hmm.
Also for pretty good extension. Alrighty. Let's go ahead and bring it down. You did say down first, right?
Don't remember what I said.
Well, it's okay. Alrighty, I'll call it 85 maybe, or 75.
Okay.
Okay, I felt like you definitely had a lot more passively. I think I could push you into a little more.
Do I need to?
No, that's okay.
Okay.
Unless you want it.
Mm-hmm.
Now you can go ahead and bring it out for me. Okay, you can relax. I'll call that maybe more like 65. Maybe more like 57.
Okay.
Okay. Now let's move on to ulnar and radial deviation.
Okay.
So I'll have you scoot back a little bit. Perfect. We're gonna grab that capitate again, which we're using all the same landmarks as before. So just this bone in your hand. Of course, gonna line up here and here. Would you like to go out or in?
Let's go out and then in.
Okay, let's do it. Alrighty, so you can bring that pinky out. Okay, great. I want to say last time you said like 35. It's I think fairly even. I don't remember what you
Okay.
said, but
I don't remember either.
more like 33.
Okay.
I kind of feel like that's what it was before. And then we can go in. Okay, and you can relax.
Mm-hmm.
Maybe more like 20.
This one's feeling less.
20. More like 15.
Okay.
Okay. Now we're gonna do our MCP flexion again, so you can put that in neutral. Perfect. We'll go ahead and
Just move my thumb out of the way.
perfect. And we're gonna be using the same landmarks. Okay. So your puncher, your knuckle there, and then your second metacarpal and your proximal phalanx. And then I'm gonna passively move you into this one just to check the end feel.
Mm-hmm.
Okay. Feels firm. And then we'll get our landmarks and give it a go. Okay. I'm gonna stabilize here. And give it a little flex. This looks like an even 90 to me a little bit. Or an 84 or 85. Okay. Now we'll do extension. So I'm just gonna kind of passively move you through this. It's pretty firm there. Okay. And I'll also kind of do some passively. Kind of looks like a lot of extension in this joint. We'll give it a 45. We'll give it a 43.
Oh man.
Okay. Now we are going to do our hip, our proximal interphalangeal joint.
Okay.
There we go. So I'm going to be using the same landmarks. Drop that PIP joint. I'll just kind of passively move you through it. Another firm. I think you definitely have some hypermobility
Seems like it's just in my hands though.
going seems like
Yeah.
that's a good bet. Okay. Now I'm just gonna go ahead and move through it. It's seeming like a. It's like a one. What did I say last time? 140 or something.
No.
It was like 130. Something.
Yeah.
This is seeming like the same. Maybe 125.
Oh man.
Maybe 130.
Oh boy.
Okay. An extension. Sorry.
Oh,
We're
sorry.
doing that one more time.
Yep.
That's okay. Art pip. Alrighty. And I'm just gonna move through it. It's looking like not a lot. Maybe 5 degrees. Or 7.
Oh.
Okay. And we're just gonna lastly do that thumb opposition. So I'm gonna have you put your palm up, and then I'm gonna kind of hold on here, and then I'll have you bring that thumb up towards the pinky crease. That's gonna be right here. Whenever you're ready. Very good. You're perfect.
Thanks.
Okay. Finally, we're going to get you standing up.
Oh boy.
Very close. Okay. Let's get into our thoracolumbar flexion. Are you comfortable taking your shirt off?
Mm-hmm.
Alrighty, I might have you go ahead and do that if that's okay.
Okay.
Alrighty, perfect. And you can show off your wonderful landmarks that are already done out for us. So I'm gonna need my measuring. So I'll have you kind of come in front of the camera here. And I just untied my shoe. Don't mind me. So I'm going to go ahead and measure from your T1 here to your S, which is okay if I fold your hands down just a little bit, to your S2, which is right here. So I'm just gonna go ahead and take that measurement very quickly. So here's our T1 to our S2. And I'll call that 54. I'm gonna grab a pen just so I can write that down.
Okay.
Or an expo marker. And I called that a 54 centimeters. Great. Now I'm gonna go ahead and I'm gonna kind of stabilize at your hips, and I'm just gonna have you flex forward or just bend kind of your whole back forward without flexing at your hips. Does that make sense? So you're just gonna kind of be like bending at your
Just my.
everything but your hips. And
Okay.
I'll kind of hold on to your hips just to make sure you're
Should
not
we do it
doing
this way?
That would be good.
Okay.
Alrighty, I'm just gonna hold your hips if that's okay. And then go ahead and start to flex down. Alrighty, very good. Is that everything?
Let me see. Hold on.
Are you comfortable holding it like that?
Yep.
Okay, perfect. Quickly measure. Okay, and we'll call that 61. Okay. Flexion, and then we're just gonna grab our extension one more time. So instead of flexing forward, you're gonna kind of be, oh, perfect, just like that. But again, I'm gonna hold on to your hips and just kind of keep you from flexing there,
Okay.
or extending there. Alrighty, are you ready?
Yep.
Alrighty, go ahead. Whoa, lots of extension going on. Are you good to hold it there? Okay.
Oh.
You okay?
Yep.
Okay, you can relax. We'll call that 45 degrees of extension. How are you feeling? Okay?
Feeling good.
Okay, great. Good extension. Okay, perfect. So we would say 9 degrees of extension there, 54 minus 45, and then 61 minus 54, so we'll call that 7 of flexion centimeters. Very good. Now we can do our lumbar flexion and extension. So I'm going to start at that S2 prominence that we talked about, and then I'm gonna measure 15 centimeters up, and then we'll go into flexion and extension the same way we just did, and I'll kind of measure the difference there. If you could assume position. And then is it okay if I fold down your pencil? Thank you. Okay. And we'll go up 15. And is it okay if I make a mark here on your back? Okay. Perfect. Okay. Now we're gonna kind of do the same thing. So I'm gonna have you kind of flex your trunk forward without bending your hips. Alrighty, you feel okay to hold it there? Okay. Okay. And you can relax. We're gonna call that 23. Perfect. 23 centimeters, and then we're gonna go ahead and do the opposite. So come into extension. I'm just gonna grab at your hips. Go ahead. Feel okay?
Here I come. Yep.
All right. Give me just a second. Alrighty. You can relax. I'll call that 14.
Okay.
14 centimeters for lumbar flexion, or for lumbar extension, and then 23 for our flexion. And now thoracolumbar lateral flexion on each side, and then I believe we can call it a day.
Okay.
Alrighty, so I'll have you go right in front of the camera again. And this time you're going to be, instead of flexing forward or extending backwards, you're just going to be flexing to the side like this.
Okay.
So yeah, we're just going to be going just from side to side. You can kind of keep your fingers, and if it helps, you can kind of just run them down the side of your leg, and then to the other side. Does that feel okay?
Feels good.
Okay, awesome. I'll have you step. We'll do it. Have you turn around this way so we can kind of see my landmarks here. Alrighty, so this one is going to be your S2 is going to be my axis point. I'm going to be kind of just perpendicular to the floor in my stationary arm, and then I am going to be following up to T1 for my moving arm. So again, one more time is okay if I just kind of move this down a little bit. Thank you. Okay, perfect. Perpendicular. And then you can go to your left whenever you're ready. Alrighty, good job. You can relax. Alrighty, we'll call that 25.
Yay.
Or 29.
Okay.
And then we'll go one more time towards the other side. Go ahead. Alrighty, I'll call that pretty much even, maybe a little bit more. We'll call that 32. Or we'll call it 29.
Oh, I'm
Alrighty.
even.
Even, which is great. And I believe that is all.
Sweet.
Thank you so much.
Thank you.